Welcome to Focus on WomenLift Health Global Conference, an event set to begin on the 6th of April in Dar es Salaam, Tanzania, where hundreds of stakeholders of the world's healthcare sector will convene to chart a path ahead for advancing women's leadership in healthcare systems. And to discuss the same in the context of East Africa, we're joined by Norah Obudho, East Africa Director at WomenLift Health. Thank you for joining us, Norah.
Thank you so much.
Let's begin with what special insight does the East African region bring to this conference, and how does it resonate, how the healthcare systems of East Africa today resonate with the challenges or the values or the goals of this conference and organization?
Thank you. I think it's an excellent question. One thing I'd really like to celebrate is bringing the conference to Africa and to East Africa, because we know more than 70% of the conferences have been held in high-income countries. And so we're excited to have this in East Africa, which previously had only 4% of conferences taking place in low-income countries. So we're excited as East Africa to be hosting the WomenLift Health Global Conference. We know that these conferences play a crucial role in low and middle-income countries because it provides a platform for knowledge sharing, exchange, and capacity building and collaboration among various stakeholders. Now, when we look at East Africa, we've been facing numerous health challenges, and these include resource constraints. We all know that the financing for health is still at 7 or less than 7% as expected within the Abuja Declaration. And therefore, this results in infrastructure limitations, and we've been seeing a lot of disease outbreaks, health systems that are not resilient. And even currently, we can see that the health workforce is not optimal, and they're also frustrated, while we know that the health workforce is really the backbone of the health system. When we look at East Africa, in all our health systems, I believe we have not addressed leadership as a component. And this is what excites me, that in East Africa, we will be looking, as we host this conference, on the crucial component of leadership, how it looks like and what we want it to be. And that's why we are reimagining it. If we can look at it as a component of the health system and look at the gender equity issues around focusing on women's leadership and why we need to invest in it and why we need to have inclusive workplaces and an inclusive health ecosystem, then I think this is what we are bringing out, and this is what we want to discuss in this health conference.
Excellent. You just packed quite a lot for our audience there. You spoke about conference equity, gender equity, the lapse in East African health infrastructure, the lack of financing. Quite a lot of issues there, quite broad. If we could streamline them to, again, in the context of women in the healthcare workforce of East Africa, what are some specific top challenges that the conference wants to take on? And that if you would care to share them with us.
Sure. WomenLift Health also works based on evidence. And what we've seen as barriers that women are facing right now is balancing home and work. Can you be a mother, for instance, and can you be a career woman? And that has been a barrier for women. How do you balance the two? And in this place, we will be discussing that in some of our workshops. How do you look for work-life integration? Because this is becoming a barrier for women to reach the optimal levels in their careers. Another thing, of course, has been sexual harassment and gender discrimination in the workplace. And we are also going to be looking at what does an institution that is enabling of women's leadership and enabling for an inclusive and safe environment to work in looks like. And these are going to be part of the panel discussions that we'll be discussing. Women are also faced with challenges around mentorship and coaching opportunities. And this we will also be having and discussing in terms of workshops and also having mentor breakfast, which is what I'm also hoping that everyone participating will engage in our mentorship breakfast and our workshops that are towards the tail end of the conference, and look at what leadership looks like, looking at who embodies transformative leadership. What does it look like? How can they implement it? Looking at institutions that are enabling and supporting inclusive workplaces. So I'm really excited that these are the barriers that women are facing, but we are here to discuss how can we change that? How can we rethink it? How can we reimagine it and make sure that women are in their trajectory and succeeding in their careers? Looking at male allyship, Who are the male allies? How can we work together? And how can we make our institutions enabling for all? And so these are the things I'm looking at in terms of the panel discussions we're going to have, the collaborative workshops, the networking opportunities, the mentorship breakfasts. So this is everything you need to be able to see to just change and shift, what leadership looks like.
Wow.
So yeah, please come and join and engage at the conference.
That is very interesting, yes. When we speak about empowering these incredible women who could lead the way, who could change the fault lines in our healthcare systems, what do you expect from the men who are joining these conversations at this conference? Because it's not just for women, you have hundreds of men also coming together in support. What do you envision for them to bring on board?
I envision for the men to come and learn, relearn, and learn and go through the whole cycle, and not to look at it that this is an all women agenda. We are in an ecosystem. We need to work. We need men to be allies to women. That is in terms of mentoring, seeding space, which is not always very easy. So that's also a challenge for the men, seeding space and supporting women's voices and participation in decision-making tables. We would like the men to come in and also just look at women not just as providers of health or consumers of health, but also leaders as well, and having every right to be at the decision-making table. So for me, I'm looking at men to come in, to be ready to, break the patriarchal systems that have been pushing back women into leadership, and that they can become allies, be in solidarity with ensuring that women are participating effectively, and that we can really reimagine leadership together on the same table and craft health outcomes that are beneficial and positive for the populations. And that would be populations in East Africa and across Africa and across the continents. So I'm really encouraging the men to come in to engage, so that we can have, gender equity and health outcomes addressed as we look at our SDGs.
You rightly call them to become allies and to come and learn and not feel that they are not part of the problem or the solution. I suppose that is why the conference is bringing together both genders and everyone else who identifies in whatever manner they do to come together and make this a more inclusive, and how that impacts healthcare. Now, among all of these stakeholders that are coming to this conference, what are some provisions being made for them to collaborate, even after the conference is over, to partner, to exchange in a way that this continues for a longer period of time, not just within their own organizations, but the exchanges that are going to happen during this conference? So how are they going to use this platform? What provisions are there?
So as we're looking at this platform, of course, already within the conference, we'll be networking, we'll be having workshops, and we are really encouraging that we will exchange our contacts, and we'll be learning about each other's organizations and looking for synergies that will work for us moving forward. We will continue, of course, with our outreach, looking at the outcomes of this conference, looking at what we've been talking about in terms of our rallying call, which is to inspire collective action and empower stakeholders to drive positive change in global and public health leadership. So if we are creating a movement and we are agreeing upon a goal that we need to look at empowering women's leadership and engagement, then I think we are already creating a movement that will continue partner to partner, region to region. There'll be learning that we have as East Africa that we'll share with West Africa, that will be shared with Southeast Asia. And I believe this networking and continued output from the results of this conference shall be shared around, and we'll create a community, of stakeholders rallying towards reimagining leadership and changing the institutional environments that we're all working it to be inclusive and safe as well. So I'm really looking at post-conference outputs in terms of like having exchanged contacts, having engaged on a topic. How will we then forge together as one in terms of putting out the discourse in investing in women's leadership?
Right, because these challenges, these barriers are institutional in nature and require consistent long-term effect to show change and impact. Now, coming back to the fact that this is happening in East Africa, the conference, and that you represent for your organization, the East African region. What would you say to those who are watching the show? What to go to during the conference? Those who are interested in networking with other stakeholders of healthcare in East Africa, within East Africa, and those who are from outside of East Africa, and those who are keen on East Africa. What would you suggest them to, how should they go about navigating the conference this weekend?
This weekend, we have an amazing platform. So we have the WomenLift Health Conference platform where you will be able to see who's there. You can engage, you can chat, you can network still within the platform. Now, for those who are not able to join us, then please just look into our website. We'll be putting out the after conference, communication outputs and, feedback, and we can still engage in that way. Because this is really a movement looking at leadership, in essence, in the region. So what I will say is that we are here. We have our platform that we're engaging in. We are going to still have, visit our website. There'll be a lot of outputs in there. And also just reach out. And I believe WomenLift Health website is an opportunity for us to engage and continually engage in the same. And for us who are here, please, let's engage in all the panels that are coming up. The Mentorship Breakfast, they're amazing workshops where we will learn and exchange, learning more around authentic leadership, looking at how to, integrate work and life, among many other things. And there'll be networking breakfast and even lunch and the breaks in between. Let's network, let's connect, and let's engage as well on the WomenLift Health website to continue on this movement.
Sounds very, very stimulating. So there you have it from Norah Obudho, the East Africa Director at WomenLift. What to look out for at the WomenLift Health Global Conference in Dar es Salaam, Tanzania this weekend, where hundreds of stakeholders of the healthcare sector will gather to challenge the barriers that keep women away from leading the way in healthcare. This was Focus on WomenLift Health Global Conference. Thank you for watching.